Welcome to our first segment of In One Breath, a new weekly series during the month of November to bring you information about lung cancer and the American Cancer Society's mission. My name is Megan Wessel. I'm the Vice President for Cancer Control for your American Cancer Society. You know, lung cancer is the second most common cancer and is also the second leading cause of cancer death in the United States. We have partnered with Grady Health System, a longtime supporter of the American Cancer Society, to answer questions here today regarding the importance of lung cancer screening at any time, but certainly during this pandemic. You know, at the beginning of the pandemic, a lot of medical procedures, including cancer screenings, were largely put on hold because we wanted to focus on those urgent needs and we wanted to make sure that we reduce the risk of spreading COVID within our healthcare systems. And that was okay. That was the right thing to do. But as a consequence, we have seen a substantial decline in cancer screenings. And the American Cancer Society, like many other healthcare organizations, including Grady Health System, is very concerned about the impact of delaying these important cancer screenings. So joining us today from Grady Health System is Dr. Eric Flenaugh. Dr. Flenaugh is the Director of Diagnostic and Interventional Pulmonary Service at Georgia Cancer Center for Excellence and the Director of the Lung Nodule Clinic. That is a mouthful. He is a very impressive guy. He is also a leading physician and a frontline healthcare hero in the fight against COVID-19. So first and foremost, thank you for everything you're doing to keep people healthy in the state of Georgia and for joining us today. So welcome, Dr. Flenaugh, and thank you for being here.
Thank you. Thank you for having me.
Few questions for you that have been provided in advance of the call from our listeners. So let's get right to it. The first one, what should people expect in order to feel safe to get their screenings?
We should know that at our health center, Grady Hospital, as well as many health centers around the nation, the hospitals have put forth and implemented the CDC guidelines for hospitals seeing patients in both an inpatient and outpatient setting. Entering into our hospital, you'll receive a temperature scan coming in. You'll be provided a mask, and all the employees will be wearing a mask. Appointments are coordinated and planned for the healthcare screenings so that for those patients coming in for the CT scans, there's cleaning before and after so that the area is sterilized. And the appointments are very, streamlined so that they stay time efficient. Patients can get in and out, and then appointments for follow-up of the results are very organized as well.
Thank you. That's very helpful. You know, that even sounds a little bit safer than when I went to the grocery store this morning. So I think the patients and the community should feel very safe in getting their cancer screenings. So I was wondering, how would a person know if lung cancer screening is right for them?
I would say, first of all, and probably the most important thing is have a discussion with your primary care physician. The patients need to be fully aware of what the risk factors are, and it's usually the patients that are aged 55 to 74 who have smoked at least what we score as a 30-pack year tobacco use history. And what that means is, on average, if they smoked a pack a day for about 30 years, or if they smoked 2 packs a day for about 15 years, that would come into a 30-pack year history. And then from there, they must be willing to undergo the process of screening because takes commitment. You have yearly screening CAT scans and the follow-up appointments. So we don't like patients to drop out and lose the benefit of screening. And finally, they should make sure that they have access to a facility that has set up and established a screening program.
Thank you very much. That was very helpful information. Can you tell us a little bit more about the low-dose CT scan? What is it? How does it work? And what will happen if I go to get one? For example, does it hurt?
No, it doesn't hurt. It's actually a very simple process. The whole timing for it should be between 15 to 20 minutes. So a low-dose CT scan is just a standardized CT scan, or CAT scan as people may refer to. They'll come in, they lay down on a stretcher, and they're kind of placed into a tube which runs the scan. You do get a radiation dose to get the CT scan, but it's a lower dose. We realize that the exposure over a period of time could carry a risk if it's done unnecessarily. So they use a lower dose to make the risk and benefit ratio more towards the benefit side of it. You'd come in, you change clothes, get all the metal zippers, garments off. You'd be provided a gown. You lay down. They'd give you some instructions about the breathing during the test. You'd go through. The scan takes just a few seconds to run. Most of the time would be prepping and getting dressed afterwards. And then following that, you'd be able to leave out and get the follow-up appointments as arranged with your primary care physician.
Thank you, Dr. Flenaugh. That was very, very helpful. I know as soon as we're done today, I am going to call my relative that I think would probably qualify for lung cancer screening and make sure that they understand how important it is that they contact their doctor as soon as possible and talk to them about whether they're a good fit for getting screening. As I mentioned earlier, the American Cancer Society and many healthcare systems, including Grady Health System, we're very concerned about the potentially devastating impacts of so many people delaying their screenings. So please help make sure that our listening public understands why should people not delay in getting their cancer screenings.
We know that delaying cancer screening decreases the opportunity for us to detect and find lung cancer early. The thing about lung cancer is the earlier you find it, the better you have an opportunity to actually get it treated with the intent of having it cured. If we divide lung cancer into three main categories, and that would be those that have local disease, which would be one area, versus having regional disease, which may involve lymph nodes, and then distant disease, which involves the entire body where it has spread. Our goal is to catch it in the localized disease time frame, because if we catch it in localized disease, the survival rate over 5 years is about 55.6% of patients. Screening is very important. We found in large trials that looked at lung cancer screening that by performing the screening exams, you can decrease the death rate by about 20% compared to those that aren't screened. And it only takes about 320 people being screened for the medical or healthcare system to decrease lung cancer deaths by 1. So for every 320 patients screened, 1 less person dies.
So in one breath, I'm going to say the key messages that I think you told us today. And that is, number 1, it is safe to get your cancer screenings. Number 2, please make a commitment to have you or your loved ones contact your doctor to see if lung cancer screening is right for you. Thank you, Dr. Flenaugh. That was incredibly important information for the community to know. And thank you, everyone, for listening today. We also want to thank our In One Breath campaign partner, Grady Health System. For more information, please feel free to visit the American Cancer Society's website, which is very easy. It's just cancer.org. And we look forward to seeing you next week in our next segment on In One Breath. Thank you so much and have a great day.